Hi everyone, my name is Nick Delmonico. I'm the CEO and co-founder of Strados Labs. When I was 5 years old, I had my first asthma attack. And I remember not being able to understand my symptoms like wheezing, coughing, and shortness of breath, and communicate them to my care team before it was too late. So at Strados Labs, we created a technology that enables care teams to get ahead of worsening events, which improves outcomes and ultimately can save lives. And at Strados Labs, we believe in making every breath count. There are over 400 million people worldwide suffering from airway diseases like asthma and COPD. In the United States, each year we spend over $115 billion on the cost of care. And what's worse is that these patients come into the hospital and back again at extremely high rates. Nearly 33% of patients with COPD who are hospitalized will be back within a 90-day window. Not only is this extremely expensive, it's bad quality of care and bad quality of life. As an asthma patient myself, I understand the challenge of recognizing my symptoms and communicating those symptoms back to my care team. So I teamed up with my co-founder, Richard Powers, and our CTO, Jason Crow, to help us develop the technology that will ultimately solve this problem. Richard and Jason worked at CardioMEMS for over a decade together, developing the CardioMEMS system, which was able to successfully reduce heart failure hospitalizations by nearly 50% by identifying symptoms early. Our Chief Medical Officer, Dr. Mitchell Glass, is a pulmonologist who was trained at the University of Pennsylvania and has spent the last 30 years developing new drugs to solve these big problems. Our technology is sold to hospital systems and large practices who are engaged in telepulmonary rehabilitation. This is getting patients who have been hospitalized back on their feet across rehab hospitals and the home to avoid worsening events. But they also need the technology to help them identify what's happening early and get ahead of those events. So that's why we created the Strados system. It's a small wearable device that enables the acquisition of lung sounds to detect changes in those sounds like wheezes and coughs and make that information available to the care team across the care continuum. This ultimately can avoid ER visits, save money, and improve care. We sell our technology to hospitals and large practices which are engaged in telepulmonary rehabilitation, which is a nearly 1 million cases per year market. At $400 per patient, it's a nearly $400 million revenue opportunity. From there, we intend to expand into chronic airway diseases like asthma and COPD more broadly, which is a nearly $12.2 billion market opportunity. This is an exciting space for acquisition. We have seen a lot of activity from traditional technology companies to traditional medical device companies who have acquired smart sensors to help augment their existing portfolios and get into new respiratory care markets. Beyond respiratory care, this technology can be used to help enhance the way that we manage and monitor data in respiratory clinical trials, smoking cessation programs, and sleep care. We hope you join us on our journey to make every breath count. Again, my name is Nick Delmonico, CEO and co-founder of Strados Labs.